Hi everybody, it's Lawrence Maas here, registered osteopath and homeopath here in Barbados, and this is the third in a series of videos about the 5 laws of perfect health. How do you rev up your metabolism by eating by metabolic type? It's really all to do with fat metabolism. Patients currently taking blood pressure medication must avoid applying this information, as it only really applies to humans who are on not any medication for blood pressure control. This is the only way we can interpret it properly. Okay, so as you well know, no single diet works well with everyone, and the same foods that keep your best friend slim or spouse trim or thin can wind up causing you to become fat and overweight or possibly diabetic if you imitated them. The key element in this equation, I'm going to tell you, actually turns out to be the autonomic nervous system, which can be either sympathetic or parasympathetic. Or in other words, is the nervous system overstimulated or is it understimulated? The nervous system actually influences the metabolic type, and it also influences the circulation, and our food also has an influence over it too. So the protein-carb ratio describes the food that affects the nervous system, that affects the blood pressure, that affects the metabolism. Anyway, a bit complicated, but in this video I will introduce you to the concept of metabolic type. The take-home message is to be able to do 3 simple tests, the same which we do at our clinic, which you can do easily and safely. You basically have to take your blood pressure, you have to see how long you can hold your breath for comfortably, and then thirdly, you want to take the metabolic type quiz that is on our website www.themaasclinic.com. Then you'll determine your metabolic type. Once you know that information, you can then choose how to ratio your food on your plate in terms of carbohydrates, proteins and fats. And this is a very neat tool, and it's called the 3rd law of perfect health. To work out if you are a sympathetic overstimulated carbohydrate type or a parasympathetic chilled out protein fat type, you must look at your blood pressure. For this home assessment, one needs to actually have a really good blood pressure monitor. So if it's greater than 46 on the differential, this is a sympathetic type. These are the tendencies. These people will usually have a large pupil, increased body temperature, increased pulse, reduced appetite, unable to relax, feverish or cold, sweats, gags easily, and usually has a tendency to have higher blood pressure. This is a carbohydrate type. And of course, if you're somewhere between the differential of 38 to 45, this is a balanced type. A healthy balance between the 2 states of the nervous system usually relates to the mixed type. More about that a little bit later. And then of course the 3rd one, which is the opposite, which is less than 37 on the differential. This is the parasympathetic type. Small pupil, decreased temperature, decreased pulse, increased appetite, feels lightheaded and dizzy spells, warm hands, muscle cramps, gag reflex, slow. This is usually a protein and fat type, characteristically having slightly lower blood pressure. Determining your metabolic type is very important, as it will allow you to emphasize a certain way, you're certain of it, a certain way of eating to encourage greater energy and therefore weight loss. The 2nd test in the series, the list listed, the breath hold test. How long can you comfortably hold your breath for? This is kind of a physiological marker. Now, someone who's a carbohydrate burner, fast oxidizer, a sympathetic type, they usually have a breath rate greater than 16 breaths per minute and cannot hold their breath for longer than 50 seconds. Interesting, try it. Slow oxidizers, protein and fat burners, their breath rate is less than 14 breaths per minute at rest, and they can hold their breath for longer than 1 minute. Mixed oxidizers actually share the characteristics of both the slow and the fast oxidizers, or the carb protein type, and they usually have around 15 breaths per minute at rest. The 3rd step in the series is metabolic quiz. This is a series of yes and no answers. I think it's about 15 questions, which you once again can work out what is your metabolic type tendency. Now, if you want to take the quiz for the metabolic type, then visit our website for further details. Once you know your metabolic type and how you really should be eating, here are the detailed guidelines. Analyze your answers, See which category your metabolic type fits into. Follow the suggestions carefully. while taking into consideration your protein blood type rules and the ability to choose low glycemic index to moderate glycemic index carbohydrates. That's first and second law. Okay, so being able to juggle these key areas, carbohydrates, first law, protein, second law, fats, third law, 1, 2, 3, will allow you to create any metabolism you want and any body type that you want. Whether you want to build muscle or whether you want to burn fat, this is how you do it. So what are the results? What are the benefits of doing all of this? I mean, you're putting effort into this. Well, if you apply this information on a clinical level, I can tell you, you will be able to have a certain type of metabolism, it'll be for sure, that responds to certain foods. You know, you can choose specific foods and their ratios for carbohydrates, proteins, and fats. And figuring this out will help balance your metabolism in the right way while you're losing fat and you're burning off that excess weight. What happens to you if you don't apply this information? Well, then you won't feel the energizing effects of a well-chosen diet, and you're usually going to have a tendency to gain weight and possibly develop diabetes. So that concludes the third law, the metabolic type. And visit our website for any of the handouts. Thanks for listening, and reach out and grab the health you really need to feel in order to believe. Bye for now.